Hello everyone, I am Abdul Jabbar, final year vet student, and welcome to my presentation. Today I'll be talking about a really interesting case from Theriogenology clinic at Texas A&M University. The topic is granulosa cell tumor, clinical ultrasonographic pathological findings in a heifer. So to start with some background, granulosa cell tumor or GCTs are actually the most common type of ovarian tumor in cattle. They are usually unilateral and most often seen in mature cows, but they can also appear in heifers too. Now, what makes them important is actually their hormonal effect. The increase in inhibin secretion led to the suppresses concentration of follicle stimulating hormone, the FSH, which ultimately result in infertility. Also, the changes in estrogen and testosterone led to behavioral changes and physical changes like masculinization and altered reproductive behavior. They also have economical impact too. Alright, moving to the case itself. And this was a black limousine heifer weighing about 652 kg. The owner brought her in with a chief complaint of enlarged left ovary. On rectal palpation, a multilobulated mass was felt. It was initially thought to be a cystic ovarian disease case, so treated with GnRH analog, but there was no response, so we decided to investigate further. We did an ultrasound using 7.5 frequency probe, which showed polycystic structure with hypo to anechoic areas on left ovary. We also noticed tumor angiogenesis, which raised suspicion for neoplasm or tumor. Her vitals were in quite normal range. Temperature, pulse, respiration. Her BCS was also good, 8 out of 9. Interestingly, she had masculinized neck muscle, but no bull-like behavior. A vaginoscopic exam showed her normal vagina and cervix, but the uterine horns were flaccid and not retractable, which again spotted infertility. On rectal palpation, the firm multilobulated mass on left uterine horn was again confirmed. The ultrasound revealed a large multilobulated polycystic mass with high vascularization, classic for granulosa cell tumor. The hormonal assays were following. The progesterone was 0.3 nanogram per milliliter, which is very quite low. Normally it is 1 nanogram per milliliter or above. Estrogen was 21.5, inhibin was 4.56 nanogram per milliliter. The testosterone was 111.6 picogram per milliliter. We also compared all the data, the clinical imaging and hormonal findings. So we ruled out other differentials like lipomatosis, abscess, cystic ovarian disease and lymphoma. The final diagnosis was granulosa cell tumor. Now let's talk about the treatment. We performed a left ovariectomy through ventral midline ciliectomy. We also gave antibiotics, anti-inflammatories, and tetanus toxoid. We also had a blood donor ready because these tumors are often very vascular, and that turned out to be a good decision. During surgery, the ovary measured about 28 by 27 by 18 centimeter, very large and highly vascularized. It was very difficult to exteriorize, and a major vessel was ruptured, causing severe bleeding, so blood transfusion was necessary. The abdomen was closed routinely in multiple layers, and post-operative management was done in an efficient way. On gross pathology, the ovary weighed about 3.6 kilograms and having nodular and necrotic and hemorrhagic areas. When sectioned, we found fluid-filled cyst ranging from 2 to 4 centimeters in diameter. Histopathology revealed granulosa cells with anisokaryosis and hypochromatic nuclei, with 60% necrosis in the section and some thrombosis in the vessels. After surgery, the heifer recovered well and showed the sign of estrus, suggesting right ovary with resumed normal function. Unfortunately, she was expired due to unrelated causes, but necropsy showed renewed follicular activity on the remaining ovary, a very positive sign. So to summarize the discuss and the key points here, this case confirmed the diagnosis of GCT both histologically and through the hormonal analysis. It actually notable because it is the first report to document inhibin concentration in bovine granulosa cell tumor, a novelty. From clinical standpoint, inhibin and estrogen levels are very helpful in making a diagnosis in GCT. And good news is actually unilateral ovariectomy can often restore the fertility if the tumor is benign. The overall prognosis for these cases is good. So key learning points are: first, inhibin can be a reliable marker in diagnosing GCTs. Secondly, we need some more reference ranges for other bovine reproductive hormones to guide future cases. And finally, surgical removal remain a safe and effective treatment option. Before I finish, I would like to acknowledge the Texas A&M University and Department of Large Animal Clinical Sciences and the Canton Vet Clinic for their support in this case. Thank you so much for listening. I hope you found this case interesting and informative. Thank you.